Good afternoon. Thank you for joining us today for this unscheduled briefing. Dr. Fitzgerald is taking some well-deserved time off this weekend, and she will be back for the regular briefing on Wednesday, as will the ASL interpreters. Since the media advisory yesterday, we have 7 new confirmed cases of COVID-19 in our province. In the Eastern Health Region, we have 1 male over the age of 70 and 1 female over the age of 70. These cases are close contacts of a previous known case and are connected to the cluster in Central Health Region. In the Central Health Region, we have 1 female under the age of 20, and this case is a close contact of a previously known case and is connected to the cluster in the Central Health Region. In the Western Health Region, we have 3 new cases in females under the age of 20 years of age and 1 female between 20 and 39 years of age. These cases are close contacts of a previous known case. There have been 3 new recoveries in Central Health, leaving 104 active cases in the province. Our current case count is 1,309. 3 people are in hospital due to COVID-19, and 146,081 people have been tested in our province to date. The investigation into the cluster of cases in the Central Health Region is ongoing. As of now, there are 64 confirmed cases associated with this cluster and 1 probable case for a total of 64 cases. That's 63 confirmed cases and 1 probable case. The source of infection remains under investigation. We have a cluster in the Western Health Region in the St. George's, Stephenville, Port-au-Port area. We call this briefing today because of this emerging COVID-19 cluster in St. George, Stephenville, and the Port-au-Port area. We now have 11 confirmed cases and 3 presumptive cases in this region without an identified source. Effective 4 p.m. today, we are moving communities in this area in the Bay St. George region on the west side of the Trans-Canada Highway to Alert Level 4. This includes the towns of St. George's, Stephenville Crossing, Stephenville, Port-au-Port East, and all towns on the Port-au-Port Peninsula. This also includes communities along routes 460, 461, 462, 463, and 490. In terms of Alert Level 4, to remind you, in terms of public spaces and gatherings, work from home work from home where possible. Stay within your household bubble whenever you are not at work or school. You can expand your bubble by a small amount to connect with immediate family members when necessary, bring in caregivers, or to support isolated people. Gatherings are not permitted except for religious and cultural ceremonies. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 10 people, including the officiant, and physical distancing must be respected. Public visitations and wakes are prohibited. In terms of outdoor recreational activities in Level 4, outdoor playgrounds and equipment can be used where operators allow. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas, and dance studios are closed. Group and team sports, arts and recreational activities are suspended. Performance spaces are closed. In terms of businesses and services at Alert Level 4, childcare services can operate at full capacity. Retail stores can open at 50% capacity and with physical distancing. Personal services establishment can open in accordance with guidelines. Restaurants are closed for in-person dining. Takeout, delivery, and drive-through options are permitted. Bars, lounges, cinemas, and bingo halls are closed. Campgrounds and RV parks in this area can remain open. If you live in the affected region and you have no symptoms and have not been advised to self-isolate, you can go to the parks, but you must stay within your household bubble. We encourage you to enjoy the outdoors as long as you are sticking with your very close household contacts, as we outline in Alert Level 4. In terms of travel to and from the region should only be for essential reasons, such as work, medical care, or essential support. If you have traveled to the affected region and are returning to your own community, you must monitor for symptoms for 14 days. If you develop symptoms, even if it's just 1 mild symptom, we encourage you to self-isolate and arrange for a COVID-19 test. Exposure notifications also in this area, we have 2. And this is the first is for anybody who was in Dominion in Stephenville on Wednesday, May 26, between 4:30 and 6:30 p.m. The second is for anybody who was in Walmart in Stephenville on May 26 between 5 and 7 p.m. Anyone who worked at or visited these stores on this date and at these times should book a COVID-19 test by completing the online self-assessment and referral tool on our website or call 811. Anyone subject to this advisory that currently has symptoms of COVID-19 must self-isolate. Even if you receive a negative test result, you must continue to self-isolate until 24 hours after your symptoms resolve. People who are subject to this advisory and do not currently have symptoms of COVID-19 are not required to isolate while they are waiting for their test results, but should monitor for symptoms. If any symptoms develop, you must self-isolate and get tested again. Western Health is establishing testing at the Stephenville Dome tomorrow. We encourage all residents in the area to get tested, even if you are not symptomatic or part of a public advisory. This testing will assist us to determine if there's community transmission, and if so, to what extent. As Dr. Fitzgerald indicated last week, for anyone under Alert Level 4, there's three key ways that you can help. Get tested, adhere to public health recommendations, and to all self-isolation directives. When and how to self-isolate. Regardless of where you live and what alert level your region is, you must self-isolate if one of the following apply to you. You are symptomatic, there is a positive case in your house, you are a caregiver for someone that is self-isolating, you are waiting for your COVID-19 test result, you were part of a public advisory that notifies you that you must self-isolate, or you are identified by a public health official as a close contact of a positive case. In that case, you must self-isolate until 14 days after your last contact with the person when they were infectious, even if your test is negative. Self-isolation means you cannot leave your property unless you require urgent medical care. If you do not have symptoms and you have not tested positive, you can go outside, but must remain on your property. You cannot go for a walk or for a drive. If you need essentials, they must be delivered to you. If you cannot self-isolate away from family, everybody in the house must self-isolate. If your COVID-19 test was positive, everyone in your house must self-isolate, even if you were able to self-isolate away from them. Before I conclude, I want to note that we have been receiving questions from rotational workers returning from Newfoundland, Nunavut. As per the special measures orders, all rotational workers coming from an outbreak site must self-isolate away from all household members for 14 days and call 811 to arrange testing. These workers will not be able to avail of modified self-isolation protocol, as it is only permitted when coming from non-outbreak sites within Canada. This outbreak site includes all workers coming from the Mary River mine operation by Newfoundland, Nunavut. COVID-19 vaccination clinics remain open in the Bay St. George region and all across the province. If you are not symptomatic or isolating, please proceed with your vaccination. While we are now at a crossroads in the pandemic, as we see continual importation of the virus into our province, while we continue to successfully increase our vaccination rates, vaccination provides a shield against COVID-19 for ourselves, our loved ones, our community, and our province. We encourage everybody to get the shot. Thank you again for tuning in on a sunny Sunday afternoon, and thank you everyone across this province for doing their part to stop the spread of COVID-19. Please be kind to each other and be safe. Thank you.
Thank you, Dr. Seviour. For the benefit of our speaker, there are 4 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Dr. Seviour, right off the top, there's so much to unpack there. I'll have a question there on Bay St. George here, but right off the top, you mentioned that there are 2 cases in Eastern Health that are related to the central cluster, I think. You mentioned off the top. What do you know about how they were spread and the risk posed to, I guess, the most populated area of the province?
Those 2 cases are contacts of a case that has been previously identified and was related to a previous advisory, so there's no risk in the moment with those cases to the metro area.
The advisory you mentioned, is that the one about the subway on Hamlin Road?
Yes.
Okay, thank you. And the second one, the Bay St. George area, I noticed that there was a delineation down I think it's one side of the Trans-Canada Highway compared to another. It's very early, obviously, in this. So, has there been any consideration to the general Bay St. George area as out an abundance of caution?
Yes, we did consider that, and really, at the moment, most of the cases are located in the Stephenville, Kippens area. So, out of an abundance of caution, we included the communities that surround that area, and such as St. George's, Stephenville, and the Port-au-Port area.
Thank you.
Our next questions are from Heather Gillis with CBC. Please go ahead.
Thanks, Leslie. Dr. Seviour, I know you said that you guys don't know the source of this outbreak at this point, but is this outbreak linked to any types of COVID-19 variants?
At the moment in that area, we're not entirely sure.
Gotcha. And with respect to the testing that's been happening in the school system in that area, can you say how many of the cases are linked to the school because of that testing that you saw earlier this week?
Yes, there are 5 cases. There's 4 cases in one school and another case in another school.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Will it be public health recommendation then for these schools to remain or go to the online learning format that we've seen other regions go to when we begin to see clusters form?
So currently, those the medical officer of health for that region has been in contact with the schools and is working diligently with them to make some of those decisions. And the school was closed. The 2 schools were closed for a few days last week in order to really for operational issues and to get students and staff tested, which is happening over this weekend. And we'll have more idea of what will happen in terms of results that will come back later today. But the medical officer of health is working in close conjunction with the school. And always our goal is to balance that with keeping everybody safe and keeping our children in school where they're best served.
So just to clarify, sorry, so parents should know by later today then the plan for tomorrow?
Yes.
Okay, great. And in terms of testing for the area, have more staff being deployed to the area to help with the increase in testing that's going to now happen after the exposure sites and asking for people in those areas to be tested?
Yes, it was part of all those discussions this morning that they're working hard, and they've actually been testing since Friday and tested yesterday and are testing again today, and then we'll set up at the Dome for testing again tomorrow. So Western Health has been doing a fantastic job, as have the public health nurses in all their contact tracing, and things are going really well.
Thank you.
Our next questions are from Brendan McCarthy with The Telegram. Please go ahead.
Yes, thank you. I was wondering, for your initial call for testing, I wonder what the response has been to this point.
Quite good is my understanding. Once again, I spoke with the VP of the region this morning and the medical officer of health who was covering that region this morning, and they've had a good response and have sent out you may have seen that, a request for people to come out and get tested in Western Health, and outlined who they'd like to get tested, where they get tested, how they get tested, and what testing would mean for them.
Thank you. Can you tell me, when you're dealing with a cluster in a school, for lack of a better word, how much more tangly or not tangly is it? If see it as a tree, how fast do these branches grow? Is the investigation, the contact tracing, different than in other clusters?
Really, it's really the same focus, and of course, our focus yesterday was on the schools and testing of all the students, and also then the contacts of the cases that we had within the school, and they were all in a single cohort. So that was also comforting to us to see that they were in a single cohort.
Thank you.
I will now go back to Reach Reporter to see if you have one final question. Brian Callahan from VOCM, do you have a final question?
Yes, I probably could have many, but I'm just wondering, Dr. Seviour, there's a lot of questions we could ask, a lot of information right off the top for people listening. And sometimes in the past, the media has been accused of not asking the right questions or the wrong questions. Are we asking all the right questions today? What's the most pertinent message, health-wise, to get out there today? If you were a reporter, what question would you, knowing what you know, what should we be asking today?
Well, you know what? I would ask a question that would allow me to answer the three things that I think are most important to me, having been doing this COVID for over a year now, is that at this time we need people to stay in their household bubble. I know how difficult this has been for people. I know this separation has been difficult. I do feel we've been very fortunate in Newfoundland and not locked down as similar to places in Toronto. But now we have to ask you to really stick with that household bubble in this area, and really all we're doing when we do that is keeping the contacts low, not allowing the virus to spread from person to person. The other thing I would, number two, would be I'd ask people to get tested, even with mild symptoms. I think, one time previously when I gave a briefing and I said that, the whole paradigm that we had where your mom sent you to school when you were sick and you went to work when you were sick, we just don't have that. We have the luxury of that in COVID-19 anymore. And so I really need people to get tested, even if they have a mild symptom. Don't just say, oh, it's probably nothing. I really need you to get tested. And the other thing is we need people to get vaccinated. And we're so fortunate, I believe, in Canada that we have this supply of vaccination. It's a freer flow now, and we've done such great. I think we've just done such a wonderful job here. All the regions and their vaccination teams and the provincial vaccination team, and we've got good vaccination rates. And we just need people to come out and get vaccinated and protect themselves, their loved ones, the community, the province, and beat back this virus.
Thank you very much.
Heather Gillis with CBC. Do you have a final question?
I do, thank you. Speaking of vaccinations, Dr. Seviour, Public Health is going to be going to schools in Western Health for vaccinations. Was that planned, or in light of this cluster now, is that a shift in strategy to get some vaccine in some of those younger arms and some of those younger people who have been affected during this cluster?
That was actually planned beforehand. I was informed this morning, and they also had the option open that a parent can bring their child to the vaccination clinic too. But we know how hard it is. My kids are grown now; it's a lot easier. But when they're little, just how difficult it is. So the decision was made there because they could do it and they could get to the schools to also support the parents in getting their kids vaccinated through that route, which I think is a wonderful idea in that area.
Sorry, just one more for me. How long do you expect this lockdown will last?
And, I really wish I had a crystal ball, and it would have served me well this last year and a bit, I'll tell you. But I really don't know. And really our plan is right now, we looked at it, we discussed, we hashed through, how big the area should be, and we chose the area that we felt was, the most representative to limit any spread from what we were currently seeing. Of course, tomorrow we'll know more, because tomorrow we'll have more information about cases and the testing that was done today. We always have that little bit of a lag in getting someone tested, and then it has to go to the lab, of course, and get processed. And so then, we'll look at it again tomorrow, and then in the coming days, and make decisions on based on what we're seeing and based on what the public health nurses are seeing. They're looking under every bush and under every rock to find connections and to find a source. And we always breathe a little bit more comfortable when we can find that source, but we do not have that at the moment.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, I'm just wondering if for the area you're still expecting results for testing back within 24 hours, or what people can expect once they are tested, how long the whole process will take, because we know when the outbreak happened in Central here not long ago, some of those lineups were fairly long, which is encouraging, but it takes people's time up.
Yeah, so in terms of, I think you've asked me maybe two different things in terms of lineups for testing. I think the testing went well yesterday. I haven't heard of any issues. They got the people that they had registered tested. They were very pleased with it. And I heard about the numbers they had booked today, and they were not expecting any challenges, so that's wonderful. And then we, of course, the swabs will come in. They come in frequently to the lab, and then we have a sort of, once they're in the lab, we have the obviously the lab time, which is 12 hours or so before we get that result. So we do have that sort of transport time, and then the lab time, and pretty much the reported, in the lab, it goes right into the Meditech system, and we get reports pretty much instantaneously. It's been incredible, the various structures that have been built since COVID started and that have been built by NILCHI and the health systems to allow for rapid reporting and for patients to actually rapidly access their results also online. It's been amazing what the techie people, as I call them, have been just fantastic during this pandemic. I don't know where we'd be without them.
So still looking at 24 hours after being tested that you kind of have an indication if you're positive or negative?
Yeah, and sometimes a little bit more from the transport time from the West Coast, but around that.
Okay, perfect. And you mentioned about reevaluating the alert level 4. Just wondering, will there be a briefing tomorrow to update, I guess, both Central and Western about their situations?
I don't know yet, to be honest with you. I can't answer that question, and it all depends on what comes out between today and tomorrow. But we have no update for Central for today.
Thank you.
Brenda McCarthy with the Telegram. Do you have a final question?
I do. I was wondering, is there something now established that would trigger such a decision as been made with regards to the Bay St. George area in terms of numbers, or is it something you mentioned before that it's always troubling when you can't find you haven't determined the source yet? I was wondering if there is some sort of criteria or criterion that you use in making such a decision.
Yes, for sure. And one of our biggest indicators is a non-epi-linked case. So this is what we have, and similar to what we had in Central. We are unable to find the source. If we dig and search under a rock and bush and we find that source, and then we can contain a cluster, we rest much easier, but when we don't know where the source is, then we know from past experience, and experience really all across the country, then you have to look through your whole community. You have to focus on the cases you have and draw a really tight circle around all their contacts, make sure there's no risks there, no travel, no other exposure risks, which for us mainly our exposure risk is travel, and we look for all that and investigate if we can find a source. And then in testing all the people that come out of that circle that we draw around our cases, we do the same thing there. We go to them, we check and see would there be an exposure for them where they might have passed it on. So we draw this tight circle around all our cases and investigate all their contacts to see if we can find a source of exposure. And to date now, since this began, we have not been able to find a source of exposure as of 5 minutes before I came to speak to you. So that is that's one of our biggest links to say, we don't entirely know what's happening. We need to know what's going on in the community. So the only way with COVID is that if we ask people with even the mildest symptoms to get tested, and then we also test asymptomatically because we know we can have asymptomatic spread with COVID-19. So we reach out into the community and see what kind of spread there may have been within the community, the broader community outside of the cases that we know.
Just quickly on that. So besides, limiting the spread, I take it this makes your investigation easier, or hopefully easier. And with the situation with regards to Southwest Newfoundland and what you experienced there, it give you some idea that may be the case.
Yes, and you're absolutely right, and thanks for bringing that point up for me. And it does it does two things. One, once we limit contacts, it allows public health to focus, and we're not having continued contact that we have to find. And then we also we know when we limit people's mobility, that we also limit the mobility of the virus.
Thank you.
Thank you, everyone. Dr. Seviour, do you have any final comments for today?
No, I'd like to thank everyone for coming and the reporters for taking time out on a sunny day, and I hope you enjoy some of the rest of the sunshine. And I'd just like to finish off with asking people, I know how difficult it is, I know how long it's been, to really stay within that household bubble and to limit your contacts, and that's how we limit COVID. And also I'd like to encourage you to get your vaccination. We've seen across the country the curve of COVID-19 coming down as we've been fortunate enough to increase our vaccination rates. So I would ask you also to get vaccinated and also to get tested. Get tested even with mild symptoms, or to respond to the advisory and get tested. And I think sometimes we have certain age groups that perhaps don't respond as well to advisories. They're busy, they have stuff on, they don't see themselves as at risk. But I would ask everybody who's in that area to go to the website, book your appointment, and get tested.
Thank you, Dr. Seviour. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.